Everyone. Good afternoon, everyone. Today, on World Cancer Day, I'm going to present to you on a project that we're involved with for the last 3 years called Urban Action Against Cancer, so UcanACT for short, physical activity in public urban green spaces for cancer prevention. So this was a transnational intersectoral initiative involving 8 partners across 5 countries in Europe and was funded by the EU Commission. This brought together physiotherapists, local authorities, non-for-profit organisations, academic institutions, with the overall objective to engage adults and senior citizens to practice physical activity as a tool for cancer prevention within public urban green spaces. So this project targeted people over the age of 50 who have never been diagnosed with cancer, so looking at primary prevention, those diagnosed with cancer, secondary prevention, or cancer survivors. The overall purpose of the UcanACT project was to encourage adults to engage in physical activity in the great outdoors in public urban green spaces and to establish if this project is accepted by the target group and if it had any impact on health outcomes, to which I'll come to later on in the presentation. So I mentioned earlier that this project involved 5 countries, but 3 countries were part of the implementation of the project. So Kilkenny in Ireland, we had Munich in Germany, and Bologna in Italy were all part of the implementation phase. So for the sake of this presentation, I'll focus on the Irish structures of the project. So the 2 lead partners on the consortium were Kilkenny County Council, and this is the local authority that I work for. We are responsible for the provision of an extensive range of public service which promote the interests of local communities and play a crucial role in maintaining and enhancing the quality of life of citizens. So my role in Kilkenny County Council is the Healthy Ireland coordinator, and I have a remit around health and wellbeing. The Irish Society of Chartered Physiotherapists were the other lead partner, and they are the national professional body representing over 4,000 chartered physiotherapists in Ireland. So this was a 3-year pilot programme. At the start of the project, it involved the research elements that were delivered on by the academic partners in the project. This covered evidence on physical activity for cancer prevention, good practices for cancer prevention, physical activity sessions within public urban green spaces, and challenges and barriers associated with participation in physical activity in the outdoors. Now, I won't go too much into the research elements, as I know they'll be covered in other presentations today. The research element then led to the design of pilot programme methodology and tools. This involved training manual and online learning modules for physiotherapists involved in the UcanACT programme. This covered things like screening tools, exercise prescription, and education on cancer prevention physical activity. So this was a mix of cardiovascular exercise, muscular endurance and strength, stretching and mobility. And of course, the balance exercises, all considered to be evidence-based. The training also looked at the considerations and contraindications for exercise and cancer, progression of the programme and implementation in the public urban green spaces. Kilkenny County Council developed a citizen engagement strategy for locally, and that looked at mapping who needs to be involved in terms of the stakeholders, how we're going to recruit the participants and communicate the project, the processes around the recruitment, and how do we keep those people engaged in a meaningful and effective way. Our partners in Italy also developed the UcanACT app. So the app complemented the programme that was being delivered by the physiotherapists. The app also included an education element and a chat function for social engagement. The main phase of the programme then involved the implementation and evaluation of the pilot programme. So this involved the rollout of the 2 pilot programmes that were 10 weeks in duration of each time. The these were evaluated in terms of health outcomes, so looking at standardized measurement tools around quality of life, physical activity levels, falls risk, fatigue scores. We also looked at open-ended feedback through focus groups. This happened in between the programs so that we could address any challenges or barriers, and so we could improve the program for the second pilot round. At the end, the standardized measurement tools then measured the health outcomes and looked at the focus groups again to get the open feedback. So in terms of the stakeholder team then in Kilkenny, many stakeholders were involved. So Kilkenny County Council and the Irish Society of Chartered Physiotherapists were lead in bringing UcanACT to life in Kilkenny, and we had the oversight. Trinity College Dublin were involved in many elements of the project in terms of ethics, looking at screening and be responsible for the evaluation and helping us implement the programme throughout. In terms of the physiotherapists then, we had a public-private partnership, so looking at the public physiotherapists were involved from New Park Primary Care Centre in the HSE and our private physiotherapists from Kilkenny Physiotherapy. We also had student involvement from the University of Limerick. So the students could avail of all of the training, and any of the students that were in our local hospital in St. Luke's at the time were released for the programme to help with the screening and to help with the exercise prescription and leading on the programmes each week. So student learning and development was part of this programme and a very valuable part. Other agencies were involved from the prospect of looking at promoting the project, doing communications and gatekeepers for recruitment. So for example, our wonderful local cancer support service, Cushnor, directly recruited people living with cancer and in survivorship of cancer. They were also involved in many elements of the project and really supported us through that. Other community services that we looked at to recruit were in family resource centres, the Dragon Paddlers, there's community groups, our local sports partnership, our health promotion department from the Chronic Disease Hub and our health promotion officer in cancer prevention. And our Older Persons Council was also a really good source of recruitment and through our local media. So as I mentioned at the start, it's very important to map your stakeholders who needs to be involved, communicate in a very clear manner about the UcanACT project to get buy-in from stakeholders, but also from interested participants. This was successful in terms of the recruitment only took a week for each programme and we had waiting lists each time, so there was really big appetite for a programme like this. The screening clinics then were undertook by the physiotherapists involved, and that allowed participants to be screened if GP clearance was required and inclusion to set the exercise level from the start. Then the implementation of the UcanACT pilot programs were conducted in 2024, so that happened into early 2025, so that happened over 10 weeks each time, and then at the end the program was evaluated. So from the perspective of the local authority, we have a huge role to play in our environment and having our green spaces accessible for programs, health programs like UcanACT. So we undertook an audit of our 3 green spaces in Kilkenny City. And things that were taken under serious consideration were around safety and risk assessments. There had to be parking close by. We needed to have public transport close to the green spaces. We need to select less exposed areas. Seating is really, really important, particularly for those at lower exercise levels, so there is areas for rest. Bathrooms is probably one of the most important elements of having close by or on the green space for programs like UcanACT. The exercise area then, non-slip, flat surface, areas to have balance, and they also has to be accessible for wheelchairs and mobility aids, and areas for shelter then if possible. So these were key considerations when we're selecting our green spaces. So here's some pictures from the programs that were run over 2024. So we had 2 pilot rounds. 63 people were recruited in Kilkenny. There was 212 recruited across Europe. 6 physiotherapists were involved, 36 in total. So for each session, we would have had 2 senior physiotherapists on the green space with about 3 or 4 students at each of the sessions. So we had 10 physiotherapy students involved attending the programs. And then 3 of our parks were utilised with 38 sessions delivered in total and 132 across Europe. So the results then, the participants demonstrated positive health outcomes, including improved physical activity levels, improved quality of life, decreased fatigue, improved sleep and social well-being, and sense of positive well-being from exercising in a green space. In terms of feedback, it showed the UcanACT programme encouraged the target group to be active in the outdoors. The physiotherapists and local authority roles in delivering the activity sessions were critical to successful engagement, and participants would highly recommend the programme, felt the benefits at a cardiorespiratory, balance and strength level, enhanced social interaction and reduced anxiety. Daily living tasks also improved. And there is a high value placed on the well-being and exercising in the outdoors on a green space. So I read out some of the participant quotes. Everyone was so kind. I thought I might hold people up, but everyone did the exercises in a way that suited them. I really can see the improvements in my mobility. I don't need to use my hands to push myself to stand up anymore. The physios took great care of me and worked at my pace. Everyone was so good. I found the whole experience to be excellent. I love the encouragement to improve each week in a safe way. I really benefited from the programme and love the freedom of exercising outside in all weathers. So you can see there from those quotes that people felt safe and that they could progress at their own level and that they really enjoyed exercising in the outdoors, and highlights the importance of a physio-led programme. So motivators to attend the UcanACT programme were about increasing fitness, strength, improving positive mental health, quality of life, better health outcomes, to feel good, to socially connect with each other, the cup of tea, coffee and chat. So the cup of tea and coffee were very regular after some of the sessions, and is something that we facilitated as part of the pilot programs. And as stakeholders, we need to acknowledge the importance of creating that environment that is welcoming, social, and brings people together. The cup of tea and chat afterwards is just as important for our well-being. And just to note that some people might show up for the exercise, but some people are showing up for that cup of tea and coffee while reaping the benefits of the exercise. So in conclusion then, from this pilot programme, multi-stakeholder collaboration in establishing and delivering UcanACT involved local authorities, the HSE, physiotherapists, academia, local cancer and community support services. Exercise recommendations and training for physiotherapists were effective in delivering the UcanACT pilot programme in green spaces. And the project highlighted the value of exercise in green space and physiotherapy supervision. The citizen engagement strategy developed by the Council was effective in stakeholder and citizen involvement and continued participation in the UcanACT programme. This is an example of a physiotherapist-led, community-based pilot programme that can support people with and beyond cancer, while also enhancing student learning and partnership working. With an ageing population and rising cancer survivorship, programs like this are essential for adults over 50, supporting primary and secondary prevention, recovery, and long-term quality of life in the community. And if you're someone attending today that is thinking of starting an exercise program, or you're struggling maybe to stay involved in exercise, I would recommend that you link in with your local area, see what's happening. So maybe link in with your local physiotherapist, see if they're doing classes, link in with your local sports partnership, see what's happening out there in the county, or link in if you're somebody living with cancer, it'd be a good shout to link in to your local cancer support services, where they'll be able to signpost you appropriately, because this project demonstrates that that group setting of exercise can keep you engaged in programs like UcanACT. And just also finally to highlight that this project got a lot of international attention as well. So it was presented at the World Physiotherapy Conference in Japan last year. It was also presented in Brussels in the EU Parliament. The outcomes in the project were presented at an event there, and it's also been shortlisted for a number of awards as well. And thank you.